Hello and welcome back everyone to this series of drugs in arthroplasty. In this week, let's learn about the different drugs that have a role in the bone metabolism. Before we delve deep into these drugs, let's first understand the calcium, vitamin D, metabolism and bone remodeling basics in this video. Here you can see the metabolism of vitamin D and its synthesis. So first, when the skin is exposed with UV rays, the 7-dehydrocholesterol gets converted to cholecalciferol, which is otherwise called as vitamin D3. This form of vitamin D3, when it enters the liver, it gets hydroxylated to form 25-hydroxycholecalciferol, also called as calcifediol. This is an inactive form and storage form of vitamin D. This 25-hydroxycholecalciferol, in the presence of parathormone in the mitochondria of proximal convoluted tubules in the kidney, gets converted to 125-dihydroxycholecalciferol, which is also called as calcitriol, and this is the active form of vitamin D which performs its functions. This is in brief about vitamin D metabolism, and let's have a few words about calcium and phosphate. 99% of calcium in the body is sequestered in the bone, and less than 1% is in the plasma and extracellular fluid. And in this 1%, 50% or more is in the free form, and 50% is protein bound either to albumin or globulin, predominantly to albumin. When it comes to phosphate, 85% of the phosphate in the body is sequestered in the bone in the form of different crystals. Now, let's understand about bone remodeling. So it is initiated with cytokines like interleukin 6, which recruits the osteoclasts, and these osteoclasts adhere to trabecular bone and secretes hydrogen ions and proteolytic enzymes, thereby forming a pits in these bones. And when these pits are formed, different factors are eluded from these pits, like insulin like growth factor 1, and these factors activate osteoblasts, and these osteoblasts in turn secrete the organic matrix of the bone, also called as osteoid, and this osteoid gets mineralized with help of different hormones. Parathormone, vitamin D and calcitonin has a additive or negative effect, which we will discuss later on in the subsequent episodes about each of these drugs separately. And when this matrix get mineralized, it forms hydroxyapatite crystals and new bone deposition. And in this process, osteoblasts and its precursors secrete cytokines like interleukin 6, and these cytokines again activate osteoclast, and this cycle is repeated. And this is how there is a balance of bone resorption and bone deposition that happens in the body. So with this background, in the subsequent episodes, let's understand the different drugs that are used in the clinical practice of arthroplasty: calcium supplements, vitamin D supplements, bisphosphonates, parathormone and denosumab. Thank you.